We are getting the message out in a very proactive way and communicating to help protect our community. Today, you'll be able to hear from a number of our local leaders about the importance of vaccination. After each presenter has completed the total presentation, we'll open it up for questions. Also, you have a packet of information with great resources for residents in our community. We'd like to review those with you at the end. First, we'd like to begin with our 2nd District Supervisor, Janet Wolf, also Chair of our Board of Supervisors.
Thank you, Susan. As I'm sure that you'll all agree, the health and safety of our community is a priority of elected officials. I want to thank Dr. Wada, the Public Health Department, the CEO staff, and the media for pulling together this important press conference on such short notice. Today, we are here to communicate about communicable diseases, including a possible case of measles in Santa Barbara County and the Public Health Department's response. We are going to hear from experts in the field about steps that residents can and should take. And the most important step is getting vaccinated. Because when individual residents take these steps, we know that it increases the health of our entire community. I am now going to turn the podium over to Dr. Wada, who will give you some more specific information about what we are doing in the county. Thank you very much for being here.
Great, thank you, Chairperson Wolf, and thank you all for coming. My name is Dr. Takashi Wada, and I'm the Director of the Santa Barbara County Public Health Department. I'll be speaking more broadly about vaccine-preventable illnesses, our public health role in controlling the spread of infectious diseases, and providing some general background into the current measles situation. I'll then turn it over to Dr. Fisk, and then Dr. Dean, our health officer for the county, and the lead in our current possible measles case for discussion about our local situation. Immunizations are widely recognized as one of the greatest public health achievements. In the early 1900s, prior to the development of vaccines, the United States experienced 500,000 cases and 8,000 deaths due to measles, 20,000 cases and 1,000 deaths due to Haemophilus influenza B, which causes meningitis and pneumonia in children under age 5, 100,000 cases of pertussis, and 5,000 deaths. We had smallpox, we had polio. All of these diseases had been driven to zero. They were driven to zero, but now they're starting to make a comeback. We're in the midst of a whooping cough epidemic. We've had the most cases in the state in 60 years. We even had an unfortunate death of a newborn here in Santa Barbara County as a result of pertussis just a few weeks ago, and our sympathies certainly still go out to the family. Now we're facing an outbreak of measles in the state as a result of an exposure that started in Disneyland back in December. We now have 73 cases in California, 1 in 4 of them requiring hospitalization. These are serious illnesses and a clear reminder as to the importance of vaccination, because it's also important to note that the majority of the measles cases in our current outbreak have been in children that were unvaccinated or undervaccinated. I know there are a small number of parents who remain concerned about the safety and efficacy of vaccines. So it's our job in public health to provide education and outreach so that everyone understands that countless research studies have found no link between vaccines and autism. We've also been working with the schools and medical providers on this important issue. In addition, Public Health Department has a primary and direct role in preventing the spread of disease and protecting the community. Health providers are required to report more than 70 conditions and diseases that are communicable to the local health department. Our local health department has protocols and takes steps to control the spread of disease based on the specific disease or condition. Per the California Health and Safety Code, health departments are authorized to control contagious, infectious, or communicable diseases and may take measures as may be necessary to prevent and control the spread of disease within our jurisdiction. Actions may include, generally, confirming, verifying suspected diagnoses and ensuring appropriate treatment, for example, with medications, investigating to identify others who may have been exposed to conditions that are communicable from person to person, for example, administering prophylactic immunizations and medications when indicated to prevent illness in those exposed, screening potentially exposed individuals and linking them to appropriate services, advising and educating the general and medical community about various diseases and how they can be prevented, active surveillance in response to routine and emerging diseases, analyzing data to determine disease prevalence and incidence for targeted efforts and resource allocation, issuing health officer orders requiring isolation or quarantine. This can include excluding exposed individuals from work or school settings, conducting trainings for medical providers, and communicating and coordinating efforts with state and federal partners as well as other counties when necessary. So these are some of the things that we do generally in public health. And when Dr. Dean speaks, she'll be speaking more directly to what we're doing in response to our current possible measles situation. I'll now be turning it over to Dr. Fisk, who is the Medical Director of Infection Control with Cottage Health Systems. Thank you.
Good afternoon. Nice to be here this afternoon with everyone today discussing what seems to be with an increasing frequency of infectious disease outbreaks that we are seeing linked to under-vaccination in our state. In my opinion, vaccines are a victim or victims of their own success. Most of us alive today grew up in the era where vaccine-preventable diseases were something that we didn't think much about. We took it for granted that these diseases were controlled and part of history in the United States. Over the following decades, we are seeing more and more. Today, we're talking about measles. We've heard whooping cough mentioned. There have been problems with mumps. The list goes on and on. These are diseases that if people were vaccinating their children and vaccinating themselves, would be largely eradicated in this country again. The current measles outbreak in California and the current whooping cough outbreak in California is definitely linked to under-vaccination and with increasing frequency in this state. I will be circulating a flyer today that lays out a map of California and links certain districts in the state to high rates of personal belief exemptions amongst children attending schools in California. And you can see from this graphic, between the years 2000 and 2013, there's been a very significant increase in personal belief exemptions in California for those deciding not to vaccinate their children entering school. This underscores the issue why we're here today. The flyer I will be circulating is posted on the blog today from the Washington Post, and I will refer you to that website for further information. The issue as well with parents not vaccinating their children and adults not choosing to vaccinate themselves is an issue of more than individual liberty. It is an issue that starts to have an impact on others in our community and others who are neighbors, coworkers, colleagues, and friends. Simply put, people who choose not to vaccinate are putting others at risk of serious illness. They are relying on the initiative that others take to get vaccinated for their own protection. And I think we need to take a fresh look at that practice, given the fact that vaccines for the common communicable diseases are exceedingly safe in the United States, and when used appropriately, save millions of lives and help reduce morbidity from these common and serious diseases, as Dr. Wada underscored. The concept relies upon the concept of herd immunity, with the idea being that to prevent these communicable diseases, you have to have usually 95% of the population vaccinated to control the spread and recurrence of these illnesses. There's some variability in that 95% number according to the illness in question, but that is a sort of generally accepted number, at which point, if you have that many people vaccinated, you will see these mumps, measles, whooping cough, and other illnesses fade into the background like they did decades ago when these vaccines first became available. And that is why the idea is that when someone is vaccinated, they are also protecting not only themselves, but protecting others in our population who cannot receive a vaccine because they may be immunosuppressed and the vaccine may not be safe for that person, or that they are too young to receive vaccines and therefore at higher risk. Infants do not have as robust a response to vaccines as adults do because their immune systems have not matured, and therefore infants are at particular risk because they're unvaccinated and their immune systems may not fight off illnesses as well as others who are somewhat older. And with that, I will turn it over to Dr. Dean for further discussion on the current issue of measles, and I will be passing out these graphics for your reference later.
Thank you, Dr. Fisk. I'm Dr. Charity Dean. I'm the health officer of the Santa Barbara County Public Health Department, and I'm going to talk a little bit more specifically about what's going on with a possible measles case in Santa Barbara County. I want to begin by saying that due to the measles outbreak all over California, the approach that's being taken in Santa Barbara County is very similar to that that's being taken by other counties across the state. We partner very closely with the California Department of Public Health and with the Centers for Disease Control. And in that partnership, we receive direction and advice. I want to say about the current possible case that there is one possible case of measles in Santa Barbara County. I can tell you that the Public Health Department is being very aggressive in how we approach this case. And let me give you some details on that. When we were notified that there was a possible case of measles, the priority for us is making sure that the community is safe and following our protocols to ensure that safety. What we do is we immediately isolate or quarantine anyone who is suspected of having measles, along with close contacts who may have had high exposure to that case. This is done even before we have test results back because the safety of the community is such a high priority to us. We have been receiving reports in Santa Barbara County of other reported potential measles cases. However, I can say that all of these are unlikely. So at this time, there's only one possible case that's undergoing evaluation. We do not have those test results back. There are many viruses circulating right now in Santa Barbara County and across the state that can cause a fever and a rash. Because there are so many different viruses circulating that can cause a fever and a rash, we expect that there will be cases reported to us that need to be evaluated for measles. We take each case very seriously. We evaluate and test each case in partnership with the California Department of Public Health. However, some cases that are reported are very unlikely. And this is the time of year when there are other viruses circulating that can cause fever and rash, particularly in children. It would not be a surprise to have more potential cases reported, and as I said before, the vast majority of them have been unlikely. But because of the circulating viruses, that's always a possibility. What we do when we have a possible case of measles is we immediately begin working very closely with any facility or institution who may have had exposures. So one of the first things that we do is to immediately begin a partnership with that facility or institution and identify every single person who may have had close contact or exposure to the possible case. And again, this is something we do even before we have test results back. We want to be proactive. We want to get out there and protect the community. So as we identify these people and provide possible testing or possible prophylactic measures to these contacts, public health is doing something called a contact investigation. This is a core part of what we do. We are very aggressive and we're very quick when we go out into the community. We have an excellent staff that's well trained in doing these kinds of contact investigations. Right now, the recommendations to the public to ensure public safety and the stop of any spread of communicable disease would be make sure you're up to date on your vaccinations. Make sure your children are up to date on your vaccinations. Regarding the facilities or institutions or possible contacts to this possible case, I can tell you that public health is in the process of contacting every single one of those people, of working closely with the facilities to identify who they are, and of providing the measures necessary to boost that person's immune system or protect the public or provide any prophylactic measures that we can. If someone was exposed as a contact to this possible case, we either have or will be in contact with you. So if you're not contacted by public health, please rest assured that you are not part of the contact investigation. We are fully investigating all close contacts. If you're concerned about your own immunization record and you're wondering, how can I know if I'm immune to measles? I would encourage you to contact your primary care provider with your vaccination history. Along with your primary care provider and your vaccination history, they can assist you in making decisions about whether you may need another MMR shot, that's the measles, mumps, rubella vaccine, or whether you are already immune. I'm not going to go into the specifics of that here because it's a very detailed algorithm, but I can tell you that primary care physicians and the healthcare providers in our community will know how to walk through that algorithm with people who are concerned and want to know if they're immune. One thing I am going to recommend to the community is that if you believe you or your child has a possible case of measles, the first thing that you need to do is to call your healthcare provider. What we're trying to avoid is possible cases of measles walking into a clinic without having notified the clinic ahead of time that they were coming. And here's the reason for that. Measles is a highly contagious infectious disease. It's a virus, and it can be spread through the air. And so we're recommending that anyone who believes they have measles or their child has measles, that they call ahead of time so that they don't expose a potential waiting room or an office to something that's an airborne disease. Having said that, I can say that anyone who has been exposed to the possible case is being contacted or has been contacted by the public health department. I believe that's it from me, and now I think we're going to open it up to questions.
One more piece. Thank you. We're very fortunate, really, to have such experts in our own community who talk so eloquently about the importance of vaccination for all of us to keep us all safe and healthy. In materials, there's a lot of information about where people can go if they would like more information. And at the Public Health Department, we have established an information phone line that is open during business hours. That phone number is 681-4373. Again, 681-4373. We want people to get their questions answered, and we want them to feel that they know what to do and how to do it to stay safe and keep their families safe. So with that, we'll open it up for some questions. Yes?
When will you guys know the results of the investigation on this case?
Dr. Dean?
Hi, thanks for that question. And that's actually an important question because getting test results is a critical part of the puzzle here. I can't give you a definitive answer on when we will know because of the specifics of the case, but I can say that we are hoping to have test results back within the next week, hopefully sooner. And because there's some specific nuances to the possible case, I can't give you an actual number of days. I can say that as soon as we have test results, if this is a confirmed case, we will be letting the community know. And we have been in contact with the providers, the medical providers in the community, giving them updates on this situation. And should those results come back positive, meaning it would be considered a confirmed case, we would make that information known.
Do you know if the person in question went to Disneyland?
I cannot disclose that information because that would potentially identify this person. I can say at this time we don't have any epidemiology links to Disneyland. I can't give you any more specifics on travel history.
Are we talking about a child or an adult here?
We are talking about a child.
Other questions?
Yeah. How many did they possibly come into contact with, and how many have you gotten in touch with?
That's a great question. The people during a contact investigation, which is what you're talking about when we go and identify the contacts, that's a core part of public health. And we have a very aggressive algorithm that we follow when we go out into the community. We define a close contact. We have a set of criteria that we use to define that close contact. I can't give you a number, but I can say it's ongoing. I can share with you that an active case of measles virus can potentially infect 12 to 18 people in a vulnerable population, meaning a population that is not immune to measles. 12 to 18 people can be infected by that one person. So with that in mind, you can see that our contact investigations can sometimes be very large. We're overly cautious. We're very aggressive. So we have numerous people that we're including in this. I wish I could give you a number today, but that's ongoing.
Can you tell us geographically if it's North or South County, what city?
I can't say if it's North or South County to protect the identity of the patient and the family, but I can tell you that this is an issue for both North and South County. If there's a case of measles anywhere in the county, there's always potential for spread among the community. And so we take it very seriously, whether it's in North County or South County. We see the county as one big whole.
Is there a cure, and what are the effects of getting measles?
There is no cure for measles. I can tell you that the effects can start off as a fever, a runny nose, possibly conjunctivitis. And what is difficult about measles virus is in the beginning, before the rash appears, it can look very similar to other viruses, such as influenza. Once the rash appears, that helps the physician in diagnosing that this might be measles, but it's challenging up to that point because it can be similar to other viruses that are out there.
Will it kill you?
Measles can be fatal, absolutely.
What was your reaction when you first heard that there was a possible case? We've been kind of seeing it coming up the California coast. When you heard it possibly is here, what was your first reaction?
Public health has been very hypervigilant in this county, watching for potential measles cases. We started communicating with the providers, sending out provider alerts some time ago to let them know to think measles and be on the alert. Because so many of our residents travel to Disneyland, where we knew there were cases, and travel out of county, we expected that we could possibly see a potential case here. Having said that, getting reports of suspected cases of measles or other communicable diseases is just part of what we do every day in public health. So every day in public health, we're getting reports of a possible infectious disease. We take those very seriously. We investigate every one. Up to this point, we have not had a case that we considered a possible measles case. So I can say it didn't surprise us given the outbreak in the state of California. We've been preparing for this, and we're being very aggressive.
What happens when we do have a case of measles? Is there a quarantine, or what happens to that person who has measles?
That's a great question about quarantine. Another core function of public health to protect the community is to isolate or quarantine an individual who is infectious, including people who may have been exposed to that individual who are very likely to come down with the disease. So a quarantine or an isolation is always part of a situation with something like measles that's highly communicable. We at Public Health have been using that as part of this contact investigation, as part of this situation. I'm not able to tell you who or where or how many, but I can say that's just one of the things that we're doing to protect the broader community.
Any other questions?
Oh, yeah, one more question. How long is the quarantine for? How long does someone have to stay in their house?
That's a great question. And again, this is kind of getting into the details. The length of the quarantine depends on when their exposure was. Typically, we use the number 21 days, but it can vary by the individual's exposure. It can also vary based on when we have test results, meaning if someone is in quarantine and we have a negative test result, then they can be released by quarantine. It's really on a case-by-case basis, but generally for measles, we use the number 21 days.
After the 21 days, does that mean they're cured or they don't have measles?
After the 21 days, that means that we are confident that they are outside of the period during which they would have developed symptoms and become sick. During that period, it's difficult to say if they were exposed to the level of having become infected. So after that period, we feel that we can safely say this person is not going to develop active disease and is not going to be contagious to other people.
What happens to people who get the active disease?
The active disease can be very serious. The initial stages, like I said, can mimic other viruses. Once the rash appears, it typically starts on the face or on the hairline and spreads downward over the body. This is one of the reasons why we're so lucky to live in a community that has infectious disease doctors that are used to seeing rashes, because there's lots of different viruses that can cause rashes. Fortunately, the measles rash is fairly specific. Once someone develops a rash, they can become very sick. They can have fevers up to 104 degrees. Oftentimes, they will require hospitalization. One of the serious consequences of measles is swelling of the brain, and that can result in death.
Yeah, historically, has Santa Barbara County ever seen a measles outbreak before?
I don't believe so.
I don't have any record of that.
And would you consider this an outbreak or just a possible case right now?
This is definitely not an outbreak. This is considered a possible case.
Thank you for coming. We appreciate your attention and focusing on this important issue. And our physicians and our experts will be here if you want to meet with them individually for a little bit. So thank you.